Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, and I'm glad that you could join us once again and make us part of your day. Going to talk with actor and epilepsy advocate Greg Grunberg. He's well known. He's been on Heroes. You'll know him as a star in Alias, A Star is Born, most recently with Bradley Cooper and Lady Gaga. Well, he's joining us on the program today to talk about his son, Jake. Jake suffers from a drug-resistant epilepsy. Greg's also going to talk about some of the treatments and lifestyle modifications that he uses to control his epilepsy now. Welcome to the program, Greg Grunberg. How are you?
I'm doing well. Thank you for having me on. I love talking about this, and it's not just because I'm a father of a child who has epilepsy, but now he's an adult and he's 23, but because it's important that we talk about everything, no matter what you've got going on. It's okay to talk about it. There's a stigma attached to epilepsy, and there shouldn't be, and no one should be afraid to tell people in their life that they have epilepsy, or that they're what's going on in their life, and that's been my focus for so long, and that's why I have a foundation called talkaboutit.org, which is under the Epilepsy Foundation's site, and I've been talking about this for a while. I have a podcast called Talk About It, if people want to learn more about epilepsy and the people in the epilepsy world. But I appreciate it. Just briefly, I'll give you Jake's story. When he was 7, he started having seizures, and we have gone through what I call the epilepsy car wash over all this time. He's 23 and he is controlled, but not just through medication. He will have a breakthrough every so often, like once a year, twice a year. And it's something that, drives us crazy. It especially drives him nuts, because he is so frustrated at times, like everyone else who's living a normal or even an extraordinary life with epilepsy. And Jake's a perfectly, he has a job, and he studies Taekwondo. He's just about to test for his second degree. And we've all learned over these years, is that, it's important to really take care of your health. It's important to know your body. It's important to take your medication on time, but also to seek everything else that goes into, what would be considered controlling your seizures or controlling, your own situation to the best of your ability. And through that, we've discovered, that he needs to take a nap. He's discovered he needs to take a nap. He needs to eat the right foods. And he also has something called VNS therapy, which is it's a stimulator that's right underneath his skin, right by his left shoulder, and that stimulates his vagal nerve. And that's been an incredible thing for him over the years. He's had that for well over 10 years.
I heard you mention that Jake will have, I thought I heard you say, a breakthrough every couple of years or so.
Like once a year, he'll have a breakthrough seizure, which to us, it just means, like he's well controlled, and we go to the doctor. We have good communication with our physician, with his epileptologist. But it does happen, where for whatever reason, either he didn't get enough sleep or with Jake, it's really important that he gets sleep. And with most people that have epilepsy,
I ask because a lot of stigma is associated with terminology. I, for one, did not know that if someone was controlled, that a seizure would be called a breakthrough seizure. That's something that, many of our listeners are healthcare professionals anyway, but for those of us who aren't as familiar with epilepsy, what is epilepsy? And then let's talk about VNS therapy.
Sure. I mean, epilepsy is, and again, I'm not a doctor, but through all the years that we've been dealing with, I've learned that epilepsy is defined as 2 or more unexplained seizures. So if someone has a seizure because they have a fever, or they get into an accident, God forbid, and there's head trauma, or there's a tumor, and they can point to it and say, okay, well, the result of this scar tissue on the brain or the tumor on the brain, that's what's caused that seizure. Or someone has just one random seizure in their life and never has another one, that's not epilepsy. But epilepsy, as far as I know, is 2 or more unexplained, or seizures that can't be connected to something. And our son Jake, when he was 7, started having these little staring spells, and he would sort of daze off for 5 seconds at a time, and then it developed into more, other seizures where you could actually see that he's having a seizure, and then what we call tonic-clonic seizures. They used to call them grand mal seizures, but they call them now tonic-clonic. And, So we've been, he's had all kinds of seizures. He's had brain surgery because they did find that there was a hot spot, or not a hot spot, that's what I call it, but a spot where the seizures were starting from in his brain. And that's rare. I mean, that's not something that, not everyone is a surgery candidate. Most of the time it's just, you have a perfectly normal brain, but for some reason it's firing too much. The electricity in the brain is just going, it's overstimulated. And so that's what'll bring on a seizure. And that's what the medications do. That's what the, meditation does. That's what, a good diet does, and rest and a good night's sleep does, is it keeps you, gives you the best shot at having, control over your seizures as well as VNS.
Is drug treatment always the first line? I mean, you're talking about meditation, diet, VNS therapy, and other things. Is it always the first go-to is medications, or are they often or ever considered as maybe a mid-therapy or a last resort?
No, I've never heard of medications being a last resort.
Okay.
Because medications are the first. That's the information that's out there. That's the first thing that doctors know to turn to. So that is oftentimes what is going to be the first thing. And yes, Jake falls under I guess it's kind of 25% of people that don't respond to the first medication. So you need a combination of those medications. And then Jake, beyond that, is what's considered drug resistant medication, because it works, but it works in conjunction with other therapies to control his seizures. And, it sounds like, what I'm saying sounds like, it's just, he's doing a million things. Not really. I mean, a lot of the things are, we call this, the VNS therapy is kind of his guardian angel. I mean, it's working without him actually thinking about it. When he goes to the doctor, they check the settings on it and make sure that it's stimulating his brain a little bit more at night. Every time he has activity that we can't even see, because sometimes seizures are really, really small. This device, the VNS therapy, will actually record that. So when you go to the doctor, they can pull information from it, like a little hard drive in there. It'll tell them, you had an episode, 5 nights ago. It was very short, and so they can adjust it as the same way that you adjust medications. So if Jake has all these medications, a lot of them have side effects as well, and so you really have to be in constant contact with your doctor and let them know how you're feeling. Let them know if you have an emotional outburst. That's another thing that people don't really understand, is that a seizure can take on, can manifest itself as an emotional outburst. Jake, there have been times when Jake gets really angry and he can't control it, and not physically angry or anything like that, but he's just like frustrated and really angry. And you have to know, and it's tough. It's tough when you, as a parent, or a friend or whatever, or a husband or wife, to say, relax, what are you doing? And you get into these arguments and then you realize, wait a minute, this is the brain we're talking about. The brain controls everything. It controls emotion. It controls all this stuff. So, exercise is a huge part of Jake's therapy. Huge. I mean, he's, like I said, he's almost a second degree in Taekwondo. His workouts are crazy. And the endorphins that he gets from working out, it helps him immensely. So there's just so many. It's all the stuff that you and I battle with cholesterol and with thyroid issues and whatever.
Yeah.
We all should be doing this regimen. We all know. But until we're confronted with it and it slaps us in the face and says, hey, this is life or death. Like, you don't do this, it will result in seizures that could kill you. I mean, that's what seizures. If you're driving and you have a seizure, this could really be a terrible situation.
Jake he's still a young guy. You say he's got a job. He's training in Taekwondo. He's doing all of these things. As he gets older, will the VNS therapy have to be adjusted? Will he be more and more independent throughout his life, or will he always be under strict supervision for the remainder?
He is like the millions of other people that you would never know that they have epilepsy. Never. People right now listening to this, sitting in an office, look around. There is someone in the office that has epilepsy. Unfortunately, it affects that many people. Jake, we've talked about it. I hope that my words are true, I say, Jake, they're going to find a cure for this, for your type of epilepsy. And I think you're going to be hopefully living, without the worry of seizures for the majority of her life. He's a young man. He's 23. But there is that looming, we have to deal with today. And dealing with today means that, yes, someone has to be around Jake, just in case, God forbid, something happens, all the time. It's something like when he takes a shower, he sings in the shower. I'm like, dude, sing all the time while you're in the shower. Because if you stop singing, I might think I'm going to yell at you to let me know you're okay. He doesn't drive because you have to be, like in California, I think 2 years seizure free. But again, these are little things compared to the incredible life that he's living and what he's giving to others. And he's just a very productive, normal member of society. And so I hope things change, to allow him to be a little bit more independent. But at the same time, God forbid he finds a great girlfriend that, that he ends up falling in love with and getting married and they stay together,
Yes. He needs misery like that, right?
Right. Exactly.
Hey, Greg, where can we go online and get some more information about your advocacy work, the National Epilepsy Foundation, and some more about VNS therapy and the combination of drugs that someone may inquire about with their physician? Well,
absolutely follow me on Twitter. At Greg Grunberg for sure. And then the foundation website is epilepsy.com. You go to epilepsy.com, you will find out all the information that you need to know that's out there. And then I would say go to talkaboutit.org, because at talkaboutit.org you'll see, again, it's a place for people to connect and exchange information. The other place that I think people could, specifically learn about VNS therapy would be vnstherapy.com. That's V as in Victor, N as in Nancy, S as in Sam, therapy.com. That's a really great resource. And then please, I encourage people to download and listen and subscribe to my podcast. It's really fascinating. We have I'm about to interview all these people that are, including people at the VNS therapy on next steps and what's in the future, what's in the pipeline. And it's a real hopeful thing, plus other people that are struggling and people that are successful and everyone that's touched by this world of epilepsy. And the podcast is something I'm very, very proud of. That's called Talk About It. So just search my name and Talk About It and check out the podcast.
Greg, it's been a pleasure. Thank you for joining us here on Health Professional Radio. I'm hoping to talk with you again.
I would love it. Thank you so much for having me. Great. Take care.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and check out our YouTube channel on youtube.com. Thank you.